All right, students. So again, this is like a very preliminary question that I have received, and I would need a bit of your help in finding out the exact wordings. Okay. So this was the first question. A patient with suspected morphine overdose is brought to the emergency department, and which of the following is most characteristic? So, I think this one is a simple question. We know that in opioid overdosage, we have respiratory depression, we have cyanosis, we have serious depression. So tachycardia, of course, not possible. In opioid overdosage, meiosis, constricted pupil is what we see, and hypotension is what you see. Bradypnea is the answer. I'm sorry, my marker is not working. So bradypnea is the answer. B is the answer here, right? Tachypnea and bradypnea is there. Okay, so if tachypnea and bradypnea were there, so that would become the answer. This is an easy question. Again, this is a favorite topic of FMG examiner and NEET PG examiner. They always ask a question on one of the perversions. So, person getting sexual gratification by wearing clothes of the opposite gender. Uh, can you help me with the other options? Was transvestism in there? Was transvestism in there? So if transvestism was in the options or eonism was in the option, that becomes the answer. Okay, so one of the option was fetishism, right? Fetishism, eonism was there in the options. Eonism was there in the options. Okay, so eonism is the answer. Eonism is the answer. So in that case, this is a repeat from INICT paper. I think 2 years back in INICT, they gave the exact same question, sexual gratification by wearing of clothes of opposite gender. And rather than giving transvestism, they gave the option of eonism. So as students are saying, fetishism, eonism, and exhibitionism were in the option. The answer becomes eonism. We did cover this in our class in the FMG Mission 200 Plus class. So I think you must have gotten it right, eonism. All right, now this is again, I mean, not a difficult question for sure. I'm sure all of you got it right. A patient who has alcohol dependence took alcohol after taking the prescribed drug and now is developing symptoms like discomfort, bloating, distension, all of this. And I think disulfiram was there in the option. So straightforward disulfiram ethanol reaction. This is disulfiram ethanol reaction, right? Can you help me with the other options? What were the other options? ये तो कर लिया होगा डाइसल्फिराम, सिंपल सा है. My guess is examiners are taking the questions from past years, putting them in the chat GPT and making 3 lines out of it. मुझे तो लग रहा है यही हो रहा है because the kind of language that is coming quite typical. But अच्छा है, ठीक है. So that tells us that PYQs are still important, but now that they would ask them in a clinical manner. So disulfiram is the answer. Can you tell me with the other options? What were the other options? Fomepizole. Okay. So fomepizole, of course, not the answer. What were the other options? TCA. Okay. TCA, fomepizole. What else? Chlorpromazine. Okay. So we had options disulfiram, chlorpromazine, TCAs and fomepizole. The answer is of course disulfiram. Straightforward question. अच्छा, इसके ऑप्शंस बता दो मुझे यार. A patient with schizophrenia reports that his neighbors are calling him and controlling his actions. ऑप्शंस क्या थे इसमें? What were the options? What were the options यहाँ पे? What were the options? For this question, schizophrenia question, what were the options? Delusion. Okay. And other options? Illusion. Oh, okay. Delusion, illusion, hallucination. Ah, okay. तो फिर तो ये भी सिंपल हो गया. तो अपने साइकेट्री क्वेश्चन तो काफी स्ट्रेट फॉरवर्ड हो गए. आई थिंक ऑल ऑफ यू मस्ट हैव गॉटन इट करेक्ट. आई थिंक देयर वाज अ क्वेश्चन ऑन lithium also that Yaji sir will cover. So these were the questions that I was able to find in psychiatry. There was another question where they were saying a girl was being bullied for many years. I could not really get the exact language. So if anybody can tell me the exact language, we can discuss that also. बट ये चार क्वेश्चंस तो आई एम श्योर यू मस्ट हैव गॉटन इट करेक्ट. इल्यूजन, डिल्यूजन, हेलुसिनेशन अगर इसके ऑप्शंस हैं तब तो ये आसान हो गया. तो दिस इज क्लियरली डिल्यूजन ऑफ कोर्स. चौथा क्या था? ऑब्सेशन तो नहीं था? दे आस्क फॉर हाउ विल यू डिफरेंशिएट स्किज़ोफ्रेनिया फ्रॉम डिल्यूजन. सेकंड हैंड कमेंट्री, थर्ड हैंड कमेंट्री बेबी था एक. अच्छा. देयर वाज अ क्वेश्चन ऑन एडजस्टमेंट डिसऑर्डर आल्सो. ओके. चलिए ठीक है. आई थिंक वन और टू क्वेश्चंस मोर वर देयर. विल फाइंड इट आउट. एंड एज अपूर सर वाज सेइंग वी विल गिव यू द फाइनल वीडियो which has the actually record question with the proper options. अच्छा, एक रैबिट सिंड्रोम के ऊपर भी था. ओके. सो वाज देयर द क्वेश्चन ऑन टार्डिव डिस्काइनेसिया, रैबिट सिंड्रोम? ठीक है. ठीक है. आई हैव टू कलेक्ट these questions. Okay, Apoor sir is here. Sir, do we have the third person?
Yeah, we just check out. So what I realized from your question also, they were clinical, relatable from
Yes, sir.
lectures, correct?
Right, sir.
Absolutely spot on.
Right.
I've got one more question that says about the football injury and the ACL tear. They had shown the images.
Hmm.
So what I realized as we go for the next 48 hours, we'll be glued to things. For a teacher, after the exam is over, the exam starts. How we did, how we were able to help the students or not.